5 health checkups you should avoid after age 70, not because they're useless, but because they may harm you more than help. There's a side of modern healthcare that seniors are almost never told. Some routine tests can lead to unnecessary stress, invasive procedures, and complications that reduce quality of life instead of improving it. Every year, millions of older adults undergo screening tests just to be safe. But new research shows that up to 37% of medical tests in seniors lead to treatments or follow-ups that offer little benefit and sometimes create lifelong sidebar. One of the tests on this list, the number one test, is estimated to contribute to 5% of all cancer cases in the United States. That puts it on the same level as drinking alcohol every day. But today, we're bringing the research to light, clearly, calmly, and backed by science. In this video, we'll go through 5 checkups seniors should think twice about, why they can cause harm, and what safer alternatives you can consider. Now let's begin with the first test, one that seems harmless, but often leads to unnecessary medications and anxiety. Number 5, bone density scan. A bone density scan is a quick, painless test that measures how strong your bones are. It sounds simple enough, but for many people over 70, the results can do more harm than good. That's because bone loss is completely normal with aging. Just like gray hair or wrinkles, lower bone density is expected and not always dangerous. Yet when the scan shows mild bone loss, many seniors are placed on strong medications called bisphosphonates, even when the benefit is extremely small. These drugs can cause jawbone damage, severe acid reflux, esophageal irritation, and unusual fractures. A study in the Journal of the American Geriatric Society followed more than 1,200 women over 70. The medication reduced fractures by just 0.3% over 5 years, but the side effects were far more common. Let's look at a real example. Rose, a 76-year-old retired piano teacher, had a bone density scan that showed mild bone loss, not osteoporosis. She had never fallen, walked every day, and had no symptoms. But she was prescribed medication immediately. Within months, she developed painful reflux and jaw discomfort. She had to stop playing piano altogether. After stopping the medication and focusing on vitamin D, strengthening exercises, and a calcium-rich diet, her energy, strength, and balance improved naturally without medication. For healthy adults over 70 with no fractures, lifestyle is often more effective than medication. Strength training, resistance bands, balance exercises, vitamin D, and calcium-rich foods all make a difference. A 2022 study in Osteoporosis International found that these lifestyle habits reduce fractures by over 20%, far more than medication for mild bone loss. Number 4, brain MRI for mild memory problems. When seniors begin forgetting names or misplacing keys, fear sets in quickly. Doctors often respond by ordering a brain MRI. But here's the truth, MRIs rarely explain mild memory concerns and often create unnecessary fear and follow-up testing. Most MRIs in older adults show normal age-related shrinkage, harmless white matter spots, and small vessel changes. These are expected changes, not signs of dementia. But once a scan shows an abnormality, many patients panic. Some are sent for spinal taps, biopsies, or repeated scans they do not need. A study of more than 3,000 adults aged 70 to 85 found that 86% had abnormalities on MRI, but only 3% were related to treatable conditions, yet 12% underwent invasive follow-up procedures. Take George, a 74-year-old retired engineer. He occasionally forgot names and misplaced items, very normal for his age. After an MRI showed white matter changes, he became convinced he was declining cognitively. He stopped socializing, stopped driving, and became anxious. But cognitive testing showed he was fully normal. The MRI findings were simply age-related. With sleep improvements, hydration, and simple brain exercises, his confidence and memory stabilized within months. Unless a person has serious symptoms like seizures, rapid decline, sudden personality changes, or severe neurological issues, A simple cognitive screening test is far more useful than an MRI. Number 3, cardiac stress test. The cardiac stress test checks how the heart works under physical pressure. It's often ordered for seniors who feel tired or short of breath, even when symptoms are mild. But after age 70, this test becomes less accurate. False positives, test results suggesting a problem where none exists, can reach 40%. That leads to angiograms, stents, and even bypass surgeries that offer no real benefit for people without major symptoms. A major JAMA cardiology study found that more than half of stents placed after stress tests had no impact on survival or quality of life. Instead, these patients had increased risks of bleeding, kidney injury, and hospital stays. This happened to Raymond, a very active 75-year-old. He mentioned mild fatigue while walking uphill, normal aging. A stress test showed unclear results, which led to an angiogram and a stent. He later developed kidney problems from contrast dye and ended up hospitalized for 6 days. His fatigue was never heart-related. He simply needed better hydration and pacing. Unless you have classic symptoms such as chest pain during activity, shortness of breath, or sudden decrease in exercise tolerance, a stress test may expose you to unnecessary procedures. Safer alternatives include a simple resting EKG, a coronary calcium scan, and a discussion about lifestyle changes. Number 2, colonoscopy after age 70. Colonoscopy is a powerful screening tool, but after 70, and especially after 75, the risks often outweigh the benefits. Complications rise sharply with age. Dehydration from preparation, dizziness, kidney strain, bleeding, bowel perforation, and cognitive issues from sedation all become more likely. In adults over 75, only 2 lives are saved for every 1,000 colonoscopies, but more than 20 people experience serious harm. That's a 10-to-1 risk ratio. The U.S. Preventive Services Task Force recommends stopping routine colon cancer screening at 75. Safer alternatives include the FIT stool test, which is non-invasive and done at home, and discussion of symptoms instead of routine screening. And now, number 1, full-body CT scans. Full-body CT scans are marketed as early cancer detection, but the reality is very different. These scans expose the body to 10 to 20 millisieverts of radiation, equal to nearly 500 chest x-rays. Full-body scans often detect harmless findings, small nodules, cysts, or calcifications that trigger repeated scans, biopsies, and sometimes risky surgeries. Marcus, an 80-year-old martial arts instructor, learned this painfully. A full-body scan found a tiny lung nodule. He went through a PET scan, then a biopsy that collapsed part of his lung. The nodule was harmless. Full-body CT scans are not recommended for screening in healthy adults. Targeted scans only make sense if there are clear symptoms. These 5 tests are not bad, but after age 70, the balance between benefit and harm changes. Before doing any test, ask your doctor, what happens next if this test finds something? Will the result change my treatment? Is there a safer alternative? Do the benefits outweigh the risks at my age? Real prevention starts with lifestyle, movement, diet, sleep, and stress management. Have you or someone you love ever had an unnecessary test or procedure that caused complications? Share your experience in the comments. Your story could help someone else make a safer decision. Thanks for watching and stay well.